circle per gauze. So with this one, for instance, I'm going to go right around the pin rows in a circle, closest to the pin rows, and then I'm going to dispose of those 4x4s. Again, I'm going to come back, staying out from over my field, get this one wet again, squeeze it out, come back and get my forceps again, and then go in the next concentric circle outside from the drain. Once I'm done with that, then I can come and dispose of the gauze. I have now cleaned the actual midline abdominal incision. I'm going to get rid of those forceps that stuck with them. I've cleaned the midline abdominal incision, and I've cleaned around the pin rows. Please remember, top to bottom and from the center and out, concentric circles, depending on what type of drain you have. Now that it's clean, I can reach back over my field. I can come back up here, and I now need to dry. So again, drying once per gauze, you're going to dry from top to bottom. And then I would get a new gauze, and I would come and I would dry around the pin rose drain. So now that my wound is clean and dry, I can now put my dressing on. I have not contaminated my hands. So the next thing I can do is come and I can put the 4x4 back over it, or whatever is ordered in the doctor's order. I can come and take the abdominal pad, making sure that the blue line is running down the center, and I can put this back over the wound. And of course, I would have needed to move her dress out of the way, and my glove is sterile, so I can either take it and contaminate it now at this point. This is now a clean hand, or I could have moved it with my forearm. At this point, when you're going to put the tape on, you'd most likely want to go ahead and get your gloves off, so make sure whenever you take your gloves off that you grab it and you wrap your hand up inside of it, and then you come underneath. I would go ahead and get rid of these gloves. I would foam my hands. I have now cleaned and dried her wound. I've got the dressing on, so I need to come and put the tape on. Thus the pre-tearing of the tape. If I had not done that, I would want to do that at this time. So I'm going to come and again tape the wound. When you're taping the wound, please make sure that you pay attention to your patient's perineal area if you're close to it, because you could potentially end up getting down with the tape into the hair, and you don't want to do that. That'll make that uncomfortable for your patient. I'm going to come and tape the other side. You'll also see that you may see the sides tape, you may see the top, the middle, and the bottom. Usually when you're putting tape on, you don't want to go too far beyond the actual margin of the wound, because that's excess tape and it could irritate the patient's skin. At this time, I would have also needed a pre-labeled date, time, and initial to put on this dressing so that it would note when the last dressing change was. And typically I don't put the label over the top of the middle of the dressing, because it could occlude my view of any of the secretions that are coming out. So I would typically put mine to the side. Now that I've got the dressing changed, then I can finish cleaning up any equipment that I have. I would remove any of the pads and those types of things from underneath her, and I would dispose of any of my equipment here at the bedside. I would need to make sure and discuss with Mrs. Smith how she's feeling. Does she need further pain medication? Do you need anything else at this time, Miss Smith? And she says no. She says she's not having great amounts of pain. She says it's probably about a 2 out of 10, and it's tolerable. So I'm going to go ahead and lower her bed back down. I'm going to provide for safety. So I need to make sure the bed is low and locked. I've got it lowered to the lowest level, making sure it's locked again. And I need to address the 4 P's at this point. We've addressed pain. Do you need to go potty, Mrs. Smith? And I would ask her if she need to pee or any of that kind of thing, and she says no. Also the positioning, I need to make sure that she's got her call bell, and of course when I'm done cleaning, I would pull her table back over here. So I've addressed the proximity of her belongings, and then also the positioning of the patient. Are you in a comfortable position, Miss Smith, or do I need to move you around? And she said she'd like her head down a little bit. There's no contraindications to that, so I'm going to lower it down just a little bit. Again, I've made sure she's got her call bell and all those things. I would finish cleaning up my equipment. Again, I've got liquid in here, anything that has secretions on it. The red bag, I would probably need gloves on at this point. I would close it and tie it and dispose of it appropriately. Any of the other equipment could go in the trash can at this point. Make sure her table is clean and all those things. She's got everything that she needs. I'm going to thank her for allowing me to care for her today and doing her dressing change. And then I'm going to foam and I'm going to exit the room. Thank you very much. Good morning, my name is Heather Cox. In this video I'm going to show you how to come in and how to clean and irrigate a wound, how to obtain a wound culture, and how to apply a saline moistened gauze. At this point, if it was ordered, I would need to go ahead and put my PPE on before I entered the room. It is not ordered for this patient, but since I'm going to be irrigating the wound, I probably would go ahead and put on the gown and a mask with a face shield. For the sake of the video, I'm not going to wear this at this time, but know that I would put that on to keep it from splashing back into my face. As I'm entering the room, I'm going to go ahead and knock. I'm going to pull the curtain and provide for privacy. I would go ahead and foam in as I enter the room. Good morning, Miss Smith. My name is Heather. I'm going to be your nurse today. I have introduced myself. I'm going to go ahead and I've acknowledged the patient. Mrs. Smith, do you have any allergies to anything? She says she does not. And can you please tell me your name and date of birth? And while she's telling me that, I'm going to look at her armband and confirm that her name and date of birth match what she said, and that her armband does not indicate any allergies. So I've acknowledged my patient, asked about allergies, I've identified my patient, and I have also introduced myself. At this point, I'm going to go ahead and discuss the duration and explanation of the procedure I'm about to do. Mrs. Smith, the doctor has ordered for us to do a dressing change, and I also need to perform a cleaning of your wound, which also will entail some irrigation, which basically means putting a little bit of cleaning solution in there and going ahead and getting it cleaned up. In doing that, I'm going to have you on your side. Are you able to turn to your side? She tells me that she is, but if she is not, then I would need an assistant in here to assist in rolling her and kind of keeping her up. She is able to roll, but I'm probably going to put a pillow behind her back once I roll her to help keep her over and support. I'm also, after I do the cleaning, going to get a wound culture, which basically the doctor's ordered that so we can make sure that you don't have any bacteria growing in your wound. Whenever you obtain wound cultures, you always want to make sure that it is a clean wound. You don't want to get it from the old drainage that's in there. You want a new clean wound, and so thus we're going to irrigate and clean before we do that. After I do the irrigation and the wound culture, then we're going to put a dressing back on there and we'll get you settled. Do you need any pain medication before we start? She says she's not in any pain, and I had already come in and pre-assessed this about 30 minutes before to make sure she didn't need it. If she needed medication, I would need to give it to her about 30 minutes ahead of time to make sure that she can withstand the procedure and that she's been pre-medicated. It kind of assists with the pain. Before I came in, I had verified the doctor's order for actually the irrigation and the dressing change for the wound culture. I would have looked in the computer to see what type of dressing materials were required before I came in so that I would know what I need to bring into the room with me. At this point, I'm going to go ahead and I'm going to raise her bed up. I'm going to raise you up in the air a little bit. And the next thing I'm going to do is I'm going to lower her head, because in this position, it's putting pressure on the abdomen, and I'm not going to be able to get in there to be able to remove the dressing and do the irrigation and things that I would need to. So I'm going to lower your head down. You'd need to assess for her tolerance to make sure she could do that before we put her in this position. So at this point, the bed is now up. If I needed to, I could put the rail down at this point if it's in my way. It is not. I'm going to go ahead and uncover her, of course providing for privacy. And if I needed to put any chucks or any pads or anything underneath her, I would need to do that at this time. So currently what I have is one of the disposable chucks, and you could also put one of the pink ones underneath her as well. I'm going to go ahead and put one underneath her on the side because I am actually going to turn her towards me whenever I do the irrigation. I want to make sure that it catches any of the irrigant. Alright, so now that I have put the pad, the chuck underneath her, making sure that the privacy has been provided, at this point I'm going to go ahead and I would put on some clean gloves so that I could remove the old dressing. I've also got one of the red bags here. Per facility policy depends on where you dispose of the actual dressings and things. So I'm going to put this here at the foot of the bed, or I've also got my trash can over here. Again, if you touch the trash can with your hands, you need to make sure that you foam again. I have not done that, so I'm okay. I'm going to go ahead and get me a pair of clean gloves. Before I take her dressing off, I'm going to make sure that I inspect it, make sure that it's clean, dry, and intact. Note the last date of when the dressing was changed. And then I'm going to go ahead and put my gloves on. Also be looking at the dressing for any drainage that's come through in its appearance and amount. As I pull the dressing off, as we discussed in the other video, you'd want to make sure that you put counter traction on the skin. Again, pull the dressing so that the drainage is away from the patient so that you don't make the patient see the drainage, potentially make them sick or get worried about the procedure that's going on. So at this point, as I did in the last video, I'm going to go ahead and remove the dressing. Ms. Smith, make sure you let me know if you can't tolerate this at this point. Again, I'm doing the counter traction. I'm pulling this dressing off and away. And once I get it off, I'm going to note any color, odor, consistency, and amount of the drainage that comes off on the dressing. Once I get done noting that, I'm going to go ahead and fold it up and dispose of it in the proper receptacle. At this point, we would note that Mrs. Smith has a certain type of incision. In the last video, you noticed that we had actually a closed incision that had staples that were clean, dry, and intact. This wound, again, is a midline abdominal incision, but if you notice, it is an open wound and it has packing in it. Thus, the order from the doctor was to pack it with a saline moistened gauze, and that is what has been done here. So at this point, I do have clean gloves on because the removing of the dressing is a clean procedure. So if I felt comfortable with it, I could go ahead and I could grab and I could remove this gauze out. If I find that I'm meeting a lot of resistance, then I could potentially soak it with a little bit of saline. But as I'm doing this, I'm going to make sure I'm discussing with Miss Smith and assessing her tolerance of this. She's had it done. I had already asked if she needed pain medication before, and she was aware of what it felt like the last time. So I'm just going to monitor her for her tolerance, and as I remove it, I'm going to take it away and make sure that it is away from her so that she can't see the color, odor, consistency, and amount. As I pull this out, I'm going to be looking at it. I'm going to make sure there are no fibers left in the wound. I'm going to go ahead and dispose of it in the proper receptacle. And I'm going to note the appearance of the wound. If you'll look, it looks like it's a good beefy red, okay? Sometimes you can have drainage from these wounds, and some of the drainage you might see might be purulent, which would be like a yellow pus type material. You might see serous, which is a clear type of liquid. You could see sanguinous, which is bloody, or you could see clear to pink and blood, which is serosanguinous, which is a combination of it. So when you're looking, always note color, odor, consistency, and amount, and you need to use the appropriate terminology. Always note at this point you would want to do your measurements of your wound, so I would come back with some of the equipment that I had before. And again, I would measure the length of the wound, making sure to note from the end to end. And then, of course, I would clean this when I'm finished. Another thing that I could do is I could actually get a Q-tip, and I could place the Q-tip down inside the wound, and once I did that, I could take the Q-tip out and I could measure it for the depth. So you'd want length, you'd want width, and then you could do depth in that manner. And some facilities have other types of materials that you can use for the length, width, and depth of the actual incision. At this point, I have assessed her wound. I'm now to the point to where I'm ready to irrigate. So at this point, I'm going to turn her on her side. So at this point, since I had already assessed her wound and all of these things, I would have already removed my gloves because they were contaminated and foamed my hand. If I was worried about them getting contaminated again, then I would put, clean gloves on. Mrs. Smith would normally be able to help me, but as she couldn't, I had to move her arm above her head, and I'm going to have to move her. If I need more assistance, I would need to get help. So as I'm turning her over here, I need to make sure that I don't contaminate her wound with any of my clothing, thus the reason that I probably would have PPE on and all that at this point too. I'm going to put a pillow behind her to help keep her over so that I can irrigate her wound. And once I have her positioned here, again, I'm trying to provide for privacy throughout the procedure. I have the chuck or pad, whatever underneath her to catch the irrigant. At this point, I need to make sure and assess my patient and make sure that she's okay. She tells me she has no complaints of pain or anything at this time, so we're okay. If I need to move my trash receptacle, I need to make sure that I haven't knocked that off the bed or whatever at this point. And now I'm ready to actually set up my equipment so I can do my irrigation. I'm going to foam my hands again. And again, since I'm obtaining a wound culture, I need to do the irrigation first. So I'm going to go ahead and set up that equipment. And the types of things that I would need, certainly I've got my table. I should have it clean and dry before I start. I need to have it up to waist height because I am going to be setting up a sterile field. One of the pieces of equipment I'm probably going to use is probably an emesis basin or some other type of receptacle that I'm going to place underneath the patient to try to catch the drainage whenever I'm coming and doing my irrigation. If this is not acceptable, you could put some towels underneath it or some extra chucks as well to catch the actual irrigant. As I'm going through and doing the irrigation, I need to make sure that I've looked at the order again to confirm the need for the irrigation and if there's any certain type of irrigant that I'm using. Most likely you will use a barred piston irrigation tray, so before I start I need to make sure that it's clean, dry, and intact and that the expiration date is within range. The appropriate irrigant, this has not been opened, so it is clean, dry, and intact, and it's within the expiration date, so I'm going to use this. And I need to make sure I've got some sterile gloves, and then if I'm going to be actually doing some irrigant and cleaning, then if there's other things that I need to add to my sterile field, I need to make sure that I have those things at this point. Once I'm finished with the irrigation, I'm going to obtain the actual wound culture. So to speak to you about the wound culture, you need to make sure that the culture is clean, dry, and intact and within the expiration date. You also need to make sure what type of culture that the doctor has ordered. Typically, they'll order an aerobic and an anaerobic, so you need to make sure that you look at the label that the culture will obtain both of those specimens, because you want to make sure that you get exactly what the doctor has ordered. So I'm going to lay this back down over here. At this point, my table is clean and dry. It's at my waist height. I would not be normally talking over it or reaching over it or any of those kind of things, but for the sake of the video, you know, I'm going to have to do a few things here. I'm going to go ahead and put her rail down here, making sure she is safe and that none of, you know, her body is falling off. I'm going to get this a little bit closer so that you'll be able to see the equipment and what I'm doing here, making sure that I'm not getting her arm. So I'm going to go ahead and open this up, and I'm going to take out the barred piston irrigation tray. As I'm doing this, I'm going to go ahead and open up, and if you'll notice, this inner layer actually has a shiny side that is going down. Thus, it enables for water protection. Now, when you look at this, I need to make sure, as always, I'm up at waist height. I wouldn't be talking over it or reaching over it. If it gets wet, it's contaminated. Please remember you do have your 1-inch margin. I cannot touch anything on this field at this point because the field is sterile, unless I'm going to put on my sterile gloves and manipulate. So at this point, what I'm going to do is if I need anything for the cleaning, then I need to go ahead and add that to the field at this time, because the next thing I'm going to go ahead and do after I irrigate, I'm going to have to go through and dry it and then obtain my culture. Once I'm done with that, I'm going to lay her back on her back and then put the saline moistened gauze on. So this is the irrigation piece. I'm going to go ahead and I'm going to peel back and I'm going to add this to my field and of course step quickly away. Now this is close to my 1-inch margin, so I most likely would not use this gauze because it is there and potentially contaminated. I'm going to peel back without touching, and again, come in from the side and drop it and get away. And if there are other things that I need to add, then I would do that at this point. I believe I am now to a point to where I can go through and either put on my sterile gloves so that I can manipulate the equipment and go ahead and add my irrigant. Now to do this, I'm going to have to contaminate one of my hands once I add the irrigant, but we will deal with that when it's time. Or you could bring a second set of gloves and you could put on new gloves at that point. I'm going to go ahead and inspect the package. It was clean, dry, and intact. The expiration date is within date. I've got the gloves here. Before I put them on, I am going to go ahead and open up the outer edge, and I'm going to make sure that I have this off so it's easier because I'm not going to be able to use both hands. The other thing I could do at this point is go ahead and take the cap off of this. I'm going to put the label in my hand. If it's new, I would need to lip the fluid in the trash can and then come back and allow this to sit here so that when I pick it up, I will only contaminate one of my hands because one of them is going to need to stay sterile for this procedure. I'm going to come and open my gloves, making sure that I do not touch my sterile field so I could turn them to the side. As I put this on, I'm going to grab from the inner glove, pull this and get away. Fingers are hanging down. And I'm going to put on my first sterile glove. Then I'm going to come under the second cuff. Again, step back, fingers are hanging down, and I'm going to put on my second glove. Now as I maneuver around with this, I always need to make sure that I keep my hands above waist level, even when I'm adding liquid or doing anything else in the procedure. I'm now going to come and manipulate my equipment. So as I'm doing this, I'm going to pull the gauze out of the way. I'm going to get the tray kind of laid out here. I'm going to come and bring my piston irrigation syringe. I'm going to go ahead and kind of manipulate this a little bit to make it a little bit easier for when I'm drawing up the solution. I can go ahead and sit this here. Move my gauze here out of the way. I'm now to a point where I can add my irrigant, but make sure you're always mindful and you stop for a minute and think if there's anything else I need to do. So I need to add the irrigant here. I'm going to be able to need to draw it up. Both of my hands are still sterile, but in order to add it, I'm going to have to contaminate one of them. My dominant hand is the one I'm going to use to actually irrigate the wound. So the hand I'm going to contaminate is actually going to be my non-dominant hand, because that's the one I'm going to use to actually use the tray to hold up and to catch the irrigant. That being said, I need to make sure that I move closer to the edge so that I can get to it, but so that I'm not going to knock it over whenever I come and I'm doing my irrigation. So I'm now ready to add my solution. I'm going to come and I'm contaminating my non-dominant hand. The label goes in my palm. I'm not going over my field. I'm going to enter, and I would add the liquid to the container from 4 to 6 inches above and add the full amount that I need. Then I'm going to step back and I'm going to sit this over here. Now you can either leave, and this is contaminated so I can touch anything I want to at this point. You can either leave the cap off or you could put it back on. If you're thinking that you're going to need more irrigant, then you might need to leave it off, but you don't want to contaminate it in the meantime. If you can do it one-handed without contaminating your sterile hand, and if you'll notice, I'm not reaching over my field as I'm doing this, then I'm good. Please be mindful during all times of the procedure which hand is contaminated and which hand is sterile. At this point, I can come in and I can grab my piston irrigation syringe with my sterile hand. I can come and I can draw up the fluid. Of course, I'm having to do this one-handed. And once I've got the fluid in here, I'm now to the point where I'm ready to irrigate. The next thing I need to do is come over to my wound, and I've already discussed this procedure with Mrs. Smith, so she knows that it's going to be a little bit cold. I want to make sure that I don't use too much force on the wound because you can actually damage the wound bed. But you need to make sure what the doctor has ordered. So I'm going to come down here with my contaminated hand, and I'm going to hold the emesis basin as close to the wound as I can. Certainly this would need to be a new clean emesis basin. I've now got my sterile hand here with my liquid, and I would inject the liquid into the wound, and it would come from the top and it would drain down. Once I have done the first, I can come back with my sterile hand again. I can pull up more solution, come back over, and again, and you do not touch the piston irrigation syringe to the wound at any point. You're wanting to keep it sterile. Again, I would squirt and make sure that I go from top to bottom and side to side. Now, as you're doing this, you know, I'm trying to provide for privacy here, but you might end up having to move some of your linens and things to keep from contaminating them. You'll also notice that the emesis basin doesn't catch everything, so thus again, you'd want some chucks or pads or something down here. I want to make sure that I get the wound good and clean. And once I've done this at this point, and I have irrigated as much as need to be irrigated, this hand is still sterile. So what I could do at this point is I could come back, and I need to actually dry the wound. So I'm going to come back over, and I would get one of my 4x4s without any fibers. And when I dry, I need to make sure, and I could actually take this out if there's no more leakage. I could either sit it down here, or I could take it and put it back on another pad off to the side. I'm going to dry from top to bottom, and if I do the outside, I do not drag it into the wound. So if I did that, I would come outside, one swipe, and then this goes in the trash. And then I would get a new gauze, and then I could actually come down and top to bottom, and then this gauze goes in the trash. And then I've got a new gauze, and then again top to bottom, and this goes in the trash. And then a new one, and I'm going to come back, and I'm going to go top to bottom, and this one goes in the trash. Please make sure you do not drag anything from the wound margin or the outside of the wound inside the wound, because then you have introduced bacteria inside the wound and potentially giving your patient an infection. At this point, I have now irrigated and dried the wound, so I'm to a point where I can obtain my culture. So basically, what I have done, I have picked up my irrigation container here, the emesis basin. I do not have to worry about the field being sterile any longer because I'm done with the irrigation part of the wound. So both hands are now contaminated. I'm going to set this over here to the side until I can clean up and get rid of this. At this point, my hands probably have secretions and things on them, so I would probably take off my sterile gloves, I would foam, and I would put on clean gloves. I would then come and get the actual culture. Whenever I attain the culture, I need to go ahead and peel this down. Again, I've already